Hi, good morning. I'm Daniele Manfredini. Thanks for watching this video. We are about to perform an arthrocentesis of the temporomandibular joint, and this video is just about to comment the procedure with you. First step is to provide a disinfection of the skin to be able to enter with the local anesthesia. Thanks to our patient for being so patient. In the past, we were used to perform a double anesthesia, but now for reasons I can explain you later, apra la bocca, Anna, we have decided to provide directly an intra-articular, subcutaneous first and intra-articular anesthesia. The reference line is apra tenga aperto, Anna. The reference line is the so-called Holmlund line. Tutto ok, Anna? Going from the ear tragus to the orbit, you should stay some millimeters below that imaginary line and about a centimeter or centimeter and a half in front of the tragus. It is important that you perform all procedures, okay, with the patient in an open mouth. The technique we are going to see is the single needle arthrocentesis, which has been ideated by my friend and colleague Luca Guarda-Nardini in 2008. Basically, in the past, we were used to use two needles, one for fluid inflow and the other one for fluid outflow from the joint cavity. Thanks to our idea, we are now able to perform an inflow and outflow of the fluid from the joint cavity, everything with one single needle. So we are about to watch the technique. First, of course, we have to wait for some minutes. In the past, we were used to perform a double anesthesia, the first subcutaneous anesthesia by entering slightly above the mandibular angle with the needle inclinated at 90 degrees to enter subcutaneously and anesthetize the area in front of the tragus, and then perform a second anesthesia subcutaneously and intra-articularly, directly in front of the tragus. Honestly, that strategy, in my experience, is really long, and it is a lengthy procedure which is not necessarily related with the effectiveness or with the comfort for the patient, especially considering that the more anesthesia you are going to perform, the more the risk for side effects in terms of prolonged anesthesia and paralysis of the eye is increased. Concerning the indication for the technique, in this particular patient, you can see on the right joint a severe amount of joint fluid, so there's an accumulation of intra-articular fluid. So we are going to perform a joint lavage. The patient is 72 years old, so we are going to perform a joint lavage, a joint arthrocentesis, and based on what we are going to find, we will decide if proceeding with a synovial implementation of viscous supplementation of hyaluronic acid, or positioning directly some cortisone drug to diminish the inflammatory reaction. Teresa, puoi sistemarmi? Okay. So, no? Okay. So, Anna, pronta?
Sì.
Okay. So, it is quite normal for the patient, mi cade dal naso, Teresa. It is quite normal, tiramela più su possibile. it is quite normal for the patient to have some sort of anesthesia of the area around the eye. So this sort of palpebral ptosis is quite acceptable, and of course it is transient. First step in the meanwhile is to prepare the joint fluid to wash the joint. Of course, you must carefully check. Abbiamo fatto un ok, appoggio qua. No, ma ora non posso, dobbiamo prima caricare il liquido. Ok. You must carefully check all the sterile procedure. This is physiological solution, and as soon as the patient is able, sente addormentata?
Abbastanza.
Ok, is able
Chiudo
to.
male l'occhio.
Ok, non si preoccupi, tenga aperto, apra più possibile, Anna, lei tenga sempre aperto. So always keep in mind the reference line. I try to enter the joint cavity. Chiuda, Anna. Apra. Okay, we are inside. Apra. Chiuda. Okay. Look at the amount of inflammatory fluid. Apra. And even the sound. There are adherences there. Chiuda, Anna. You can ask the patient to open, apra, chiuda, open and close the mouth, okay? Tenga aperto. To create this sort of inflow and outflow of the fluid, so a sort of single needle circuit. You are aspiring inflammatory fluid. Chiuda, Anna. Ok? Vieni Teresa con un bicchierino o qualcosa. Apra. Chiuda, Anna. Apra. Chiuda. Ok? Apra. I know that for the neophytes it is quite impressive, but that's a wonderful technique to wash the joint. But you can see the amount of fluid that it is getting out of the joint cavity. Chiuda, Anna. Wonderful, okay? Or at least for me, it's wonderful because it is really, really useful for the patient. And basically, all this fluid you are seeing getting out from the joint is the inflammatory fluid you can evidence with the MRI. Chiuda, Anna, ok? Aperto e chiuso un po' di volte. Anna, lei è bravissima. I'm saying, apra, tenga aperto. I'm saying that the patient is wonderful. Patient compliance and cooperation in this kind of intervention is always fundamental. Look at the amount of inflammation. Chiuda. Ok, apra, chiuda. Ok,
Sento il
ok,
rumore.
il rumore è quello che noi dobbiamo pian pianino eliminare con i prossimi interventi. Chiuda. The patient is saying that she hears some sounds that are of course related with the need to break the adherences, and it is more a sort of cup sound. Chiuda. Ok, apre, chiuda. Ok, wonderful. We are done. So this is the inflammatory fluid. Ok, tenga aperto, tenga aperto, tenga aperto. Now I will go honestly with the cortisone. Ok. Tenga aperto, Anna, eh? honestly, I'm using, tenga sempre aperto Anna, fortissimo. I'm using this kind of cortisone positioning lesser than in the past, but with this kind of situation, in my mind, it is anyway an important strategy to solve the inflammatory reaction as soon as possible. How to move on during the next days? Of course, the patient will be prescribed some anti-inflammatory drugs. For just a couple of minutes, she will be asked to keep the mouth open to avoid the outflow of the drug from the joint cavity. Okay? We can try to ask Anna to close the mouth. Chiuda piano piano, cara. Bravissima. Wonderful. Okay, okay. Open. A metà, 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 metà. Ok. Chiuda piano piano. Ok, tieni premuto Teresa. Ok. Ok, fermali. Wonderful. That's it. And what I'm expecting from this kind of intervention, that the patient will come to our office within 1 week or so with a really beneficial experience from this kind of intervention. Okay, my normal procedure is to ask patient to call our office tomorrow, so the day after surgery, just to communicate with us for any possible discomfort, but the experience we have accumulated so far actually is really positive in terms of absence of side effects. And with this kind of intervention that has been able to remove a big amount of inflammatory fluid from the joint cavity, I'm really expecting a very positive course and resolution of the symptoms. Basically, the patient was not able to eat without pain, and the arthrosis on the right side of the mandible is very severe, okay, as testified by the accumulation of inflammatory fluid within the joint cavity. So that's it for now. Thanks for watching, and I hope you have appreciated this video tutorial, or call it whatever you want. Greetings and a big hug from the Italian study group of craniomandibular disorders. Ciao!